This is Kiefer. Welcome to the trigeminal nerve mnemonic. The trigeminal nerve is a cranial nerve split into 3 branches with a variety of functions, which we will cover in this video, along with the cranial exits for the 3 branches, the nerve type, and that it is the 5th cranial nerve. We will now make these words into pictures and place those pictures into a larger narrative, allowing you to follow along the story to remember more for longer. So let's get started. This is the TRISTAR general, our mnemonic for the trigeminal nerve. In the bottom left-hand corner of the screen, we see our TRISTAR general. He's got a 5 on his hat, probably to signify some important army thing, but also that the trigeminal nerve is the 5th cranial nerve. At the moment, the general seems to be watering some corn, so much so that he's created a pond, where a swan has stopped for a rest. The pond will represent the pons, where the trigeminal nerve originates from in the brainstem, and the swan will remind us of schwannomas, benign nerve sheath tumors that can grow large and compress the trigeminal nerve. Schwannoma pathology more commonly affects cranial nerve number 7, the facial nerve, but it is good to know that it can also affect the trigeminal nerve. Now, if you're wondering, the crowd in the lower right-hand corner hasn't just shown up for some corn watering. There's a rocket too, and rockets need names, baby. We're calling this one Operation V1. This rocket will represent the first branch of the trigeminal nerve, the ophthalmic branch. Operation, ophthalmic, I think it's close enough. And the V1 lets you know that this is the first branch of the trigeminal nerve. V is the Roman numeral for 5, so it basically represents branch 1 of nerve 5. Uh-oh, there's a fish in the pond. Wow, nature sure finds a way. And if you look closer, you might recognize this fish from previous videos. It's the fish from the exit sign for superb fish. Whenever we see it, we have to think sup-orb fish, superior orbital fissure. And seeing as it's an exit sign, it should help you recall that the ophthalmic branch of the trigeminal nerve exits the cranium through the superior orbital fissure. We're moving pretty fast here, but let's not run right past the general watering this corn and miss any details. This teardrop-looking water stream flowing onto the corn can help us remember that the ophthalmic branch of the trigeminal nerve is a sensory afferent limb of the lacrimal and corneal reflex, basically meaning it sends the sensory information to trigger the reflexes that initiate blinking and crying. Scientific question here. What's the only thing better than a rocket? Scientific answer? 2 rockets. This one's called the MAX V2, and it represents the maxillary branch, or the second branch of the trigeminal nerve. It features all of the latest technology, including rotor blades, an odd design for a rocket, but it's essentially here to help you remember that the maxillary branch exits the cranium through foramen rotundum. Rotor is your cue for rotundum, and foramen means hole, but you already knew that. Also, we're going to add one more superb fish. The superb fish, as you should recall, represents the superior orbital fissure. This second fish, pointing to the maxillary branch, signifies that fibers from the second branch of the trigeminal nerve also exit through the superior orbital fissure. Now, let's erect our final rocket, the V3, designed to be a bit more flashy. The top 2/3 of this rocket have a distinct texture difference from the other rockets. It's meant to look a bit like the bumps you see on your tongue. Along with this electricity bolt, meant to represent sensation, these 2 details are meant to represent that the 3rd branch of the trigeminal nerve carry tactile sensory information, the sense of touch, for the anterior 2/3 of the tongue. It's an interesting looking rocket, but we really need to connect it to the final branch of the trigeminal nerve somehow. To do this, we'll add a soldier on top, who is also a man, which we have conveniently written across his chest. The 3rd and final branch of the trigeminal nerve is called the mandibular branch. It exits the cranium through foramen ovale. So this soldier, who is a man, sitting on top of this rocket with an oval body, should help you recall that the 3rd trigeminal branch is called the mandibular nerve, and it exits the cranium through foramen ovale. Also, you may have noticed he's wearing some hearing protection. The mandibular nerve innervates tensor tympani, a muscle in the middle ear that tenses the eardrum, reducing its ability to vibrate, thus reducing its ability to proliferate mechanical sound waves, protecting the inner ear from loud noises. Sitting on top of rockets is kind of a risky business, and one of the risks is developing a sore back. That's why we'll add a nice, fat, supportive sumo belt to protect the spine. which should also help you recall foramen spinosum, another cranial exit for the mandibular branch. This one's a bit of a stretch, but protecting the spine, spinosum, I'm pretty sure it's going to work. Sometimes the weird ones are the ones that stick. To complete the flashy theme of the mandibular rocket, we'll add one of those cool, old-school rocket jaws decals to represent the jaw jerk reflex. The jaw jerk reflex is a pretty handy diagnostic tool for differentiating the location of motor lesions. What's more, its afferent and efferent impulses run through the mandibular branch of the trigeminal nerve. Just imagine saying to your coworkers, "Have we done a jaw jerk reflex?" Sounds pretty smart to me. And right on time, here comes the sensei, riding a motorized paraglide. Our sensei is our reoccurring symbol for sensory nerves, and the motor we see behind him is usually used to represent motor nerves. Since they're both here, remember that the trigeminal nerve is a sensory and motor nerve. Finally, let's return to this crowd in the lower right-hand corner. They're a peace-loving people, and they're here to protest these rockets. And what's a good protest without a few signs? The crowd is chanting 1, 2, 3. Feel the love, face the facts. Inspiring stuff. For us, let's use it as a reminder that all three branches of the trigeminal nerve are responsible for facial sensation. Feel and face are marked in red on the sign. Remember that 1, 2, 3, or V1, V2, and V3, all three trigeminal branches, are responsible for allowing us to feel the face. Chew on this. This guy took a bit more of a direct approach. Notice chew is in red, and it's also spelt with the number 3 instead of the letter E. That is because all the muscles we use for chewing, or mastication, are controlled by the mandibular branch, or V3, of the trigeminal nerve. Let's get to our final sign. This guy is just a keto freak who doesn't like carbs. I think he may be at the wrong protest. Works for me though, because carbamazepine is a treatment for trigeminal neuralgia, a pain disorder which specifically involves the trigeminal nerve. Kind of a handy coincidence. Well, that pretty much covers it for the trigeminal nerve. We've covered functions, including facial sensation, sensory impulses for the corneal and lacrimal reflexes, the muscles of chewing or mastication, noise dampening via tensor tympani, the sensation of touch in the anterior 2/3 of the tongue, and the jaw jerk reflex. We've covered cranial exits, which include the superior orbital fissure for the ophthalmic branch, foramen rotundum and the superior orbital fissure for the maxillary branch, and foramen ovale and foramen spinosum for the mandibular branch. Since both the sensei and the motor were present, we know that the trigeminal nerve possesses both sensory and motor functions, and that it is the 5th cranial nerve. Well, now you know the trigeminal nerve. I'm Kiefer. This has been Key for Learning. If you're interested in similar content in the future, subscribe to the channel, and if you enjoyed this video, feel free to like it. I'll see you in the next video.